Now, this pandemic has caused many Canadians to rethink their travel plans, but what does it actually mean for snowbirds? According to StatsCan, 375,000 Canadians spend the winter months in southern climates, and one of those Canadians leaving for home early is Sidney Margles. He is currently at his condo in Deerfield, Florida. He'll be driving home to Montreal early next week, and he joins us right now. So, Sidney, thank you for joining us today.
My pleasure.
You know, it's interesting, as you were talking to our producers about this interview, we heard from Quebec officials today, and they are urging all Canadian snowbirds who live in Quebec to come back to the province as a result of COVID-19. But it seems that you actually made your decision ahead of that advisory. So what led you to decide to leave Florida early?
I think the problem is that there was so much misinformation or lack of information that had us wondering to start with. And the second part is that I guess if you're going to fall sick, you'd rather be close to home rather than in a foreign location. And while this is a friendly location, I've been here for 20 winters, I'm not that convinced that their health scheme is as good, if not better than ours. I don't think it's better. Also, Americans have a priority if there's a problem down here. So we decided to start heading back early, and a lot of people feel the same way. Then on Friday, the Quebec Premier indicated we should all start coming back. And as a matter of fact, about a half hour ago, he said all people over 70 in Quebec should self-quarantine. So it makes you wonder, and you decide, get the heck out of a foreign area and come home.
Come home, as you say. But, you know, it's interesting because you're talking about the state of the U.S. healthcare system and how well it would cover you. But don't you have travel insurance? Don't you think that is enough to give you some confidence in the system in Florida?
Well, put it this way. You have travel insurance, it's true, but there's also a fair bit of red tape in order to get to use your travel insurance. If you have to use it, you're supposed to call into a central location in Canada, usually Toronto or London, I think, is the one that I call into, or have to call into. Then they have to give you a number. Then you go to the hospital. Then in hospitals here, they want to do what I'll call a CYA. I don't need to spell that out to everybody, but they want to do every test under the sun, which runs up charges. So the health insurance company says, "Ooh, wait a minute, don't do that. You can't do this, you can't do that." So you start wondering, are you better off being at home? And the answer is yes.
Mm-hmm. I wonder what the reaction is. You mentioned other people around you. What are people saying to that, though? As we said, hundreds of thousands of Canadians would prefer to stay in a warmer climate during the winter months, and now they're being told to essentially pull the plug on their vacations, even if they're not sick. What's been the reaction to that?
Well, I think I could tell you that in my little village here, it's actually the size of a town, in full occupancy, about 15,000 people, and there are about, that I know of, roughly 4,000 people from Eastern Canada, mostly Montreal and District. A good number have packed up their cars and are going. I know yesterday a number were scrambling to change their airline tickets. We've opted not to go by plane because the American people or the American government has been saying don't get aboard a plane. And the reason for that is really quite simple. The HEPA system on the plane may work very well, but the guy next to you could be infected and start coughing, and you can pick it up from him.
Mm-hmm. But here you are, you're
driving.
You're driving, so facing a journey. You're not worried about any kind of contamination or catching something on your drive?
Well, put it this way, there's less of a possibility. I'm staying in what I'll call decent hotel-motel accommodations. I've made those bookings. I've stayed doing them before. They're part of a large chain. We have some wipes to take with us if we feel a little wheezy about it. We'll eat in a decent restaurant or two and be home hopefully in two nights or 3 nights at the most.
Mm-hmm. Do you feel that you've received enough information as to what you should be doing once you cross the border? Because we keep hearing from officials that if you're coming from anywhere outside of Canada, you need to essentially self-quarantine for 14 days. But beyond that, we haven't received much more information. Do you think that you have enough to come home with any great confidence?
Put it this way, it's as clear as mud. We know we're coming home, and yes, we will self-quarantine. I'm fortunate to have a daughter who will be able to go out and buy provisions. But for many of the people here who are retirees who may not have any children, for example, in Montreal, what do? Do they drive across the border head to the nearest supermarket, fill up with whatever they feel they need, and then head home? Or do they go home, try by phone to get someone to bring them provisions? That's still very unclear. Now, earlier today, I received an email from David Birnbaum, who is the member of the Quebec National Assembly for my area, and he was suggesting that in light of what he read, my comments, he was suggesting to the mayor of Côte Saint Luc, where I live, that perhaps they create a volunteer group to assist people who are coming back in order to get them provisions when they go into self-quarantine.
Well, perhaps that will actually happen for people, not only, well, you have your daughter, but perhaps help other people that don't have family, as you say. Listen, Sidney, I so appreciate the time. Safe journey back home. Thank you for this.
Thank you very much.
And that's Sidney Margles, who joins us in Deerfield, Florida.